And as you all will know, atrial fibrillation is considered as a worldwide epidemic, and it is expected that the prevalence will rise tremendously in the near future. And I think that is one of the challenges for our daily AF management. So we're facing an increasing number of complex patients with multiple health problems, and it is very likely that these patients with multiple needs utilize the healthcare services for a long term. But on the other hand, these care systems are increasingly struggling to cope with these patients regarding number, but also regarding complexity. So care is provided fragmented, and this leads to poor coordination of care and poor patient outcomes. So I think it's time for a new care approach that we called integrated care. And integrated care was first more or less defined by the chronic care model, and the chronic care model was developed to contribute to improve patient outcomes by providing care that fits the needs of the patient and based on the best available evidence. And that can be provided by 6 interrelated elements from the community and the health systems. But most important, the chronic care model advocates for active participation of the patient in their own care process versus a prepared, proactive, multidisciplinary team. An interaction between those two groups would lead to improved outcomes. Well, within the 2016 ESC guidelines for the management of atrial fibrillation, we defined integrated AF management as a model with 4 major elements. And the first one is patient involvement, patient-centered care. So we need to actively involve our patients in their care process, but before they can take on these roles, they should be educated. So they should understand what is atrial fibrillation, what can I as a patient contribute to the care process to reach better outcomes. And this would also lead to empowerment for patients to undertake self-management interventions and getting them involved in shared decision-making. The second element is multidisciplinary teams. So AF management is not only provided by cardiologists or electrophysiologists, but also by general practitioners, stroke specialists, surgeons, but also allied health professionals like cardiovascular nurses. And they work together in a collaborative practice model with different education and experience in their background. The use of technology tools can be very helpful in AF management. So it can be used by healthcare professionals, but also by patients, for example, to provide information on atrial fibrillation, but also to help making clinical decisions. So it can be used, for example, as a checklist and a communication tool, but also to monitor therapy adherence and effectiveness. So you can see that actually as a navigation system to guide the users, so the patient and the healthcare professional, through the whole care process. And then finally, it's important to provide comprehensive AF care. So that means not only focusing on atrial fibrillation, so looking at rate or rhythm control, but also looking at the stroke risk and the bleeding risk and anticoagulate accordingly, and focusing on lifestyle management and risk factor management. So there are 2 new recommendations in the 2016 guidelines, and that is an integrated approach with structured organization of care and follow-up should be considered in all patients with atrial fibrillation, and patients should have a central role in their care process and should be actively involved in shared decision-making, for example. As I just said, we need to educate our patients, and actually tailored patient education is recommended in all phases of AF management. Patients should be involved to encourage them to undertake self-management and create responsibilities for their lifestyle changes. And as I said before, shared decision-making is an important thing as well. To give you a brief example how integrated care can look in daily practice, I would like to share with you results from Maastricht in the Netherlands, where we redesigned our outpatient clinic into a nurse-led integrated chronic care program. And this model has actually 3 major elements. And first of all, that is nurses that are in charge for the patient who work closely together with a cardiologist or electrophysiologist. But both have their own responsibilities. So the nurse is responsible to educate the patient and to coordinate the care, while the cardiologist can focus on the medical treatment. All procedures, so diagnostic and therapeutic procedures, are according to evidence-based guidelines, and these guidelines are incorporated in a dedicated software system. And this software system is not only an electronic patient chart, it also serves as an electronic checklist to really check if there's adhered to all the recommendations of the guidelines for this patient. And on the other hand, it is a decision support system, so it really helps to guide the users, again, the patient and the healthcare provider, to go through the whole care process. And if we put that on top of the chronic care model, we can see that there's an active involvement and education of the patient versus a prepared, proactive, multidisciplinary team. And to check if that really improved outcomes, we performed a randomized control trial. And you see here the Kaplan-Meier curve demonstrating the cumulative incidence of the composite endpoint, the primary endpoint, being cardiovascular hospitalization or death. And it was demonstrated that there was a 35% relative risk reduction based on this composite endpoint in favor of the integrated nurse-led care approach. We also looked at guideline adherence, so we took relatively straightforward recommendations from the guidelines, so diagnostic and therapeutic guidelines. So what you see here is adherence rate based on how a healthcare professional adheres to these recommendations. Putting that in perspective, we found that 82% of patients receiving integrated care that was adhered to all these recommendations versus 38% of patients who received usual care. There were also some significant differences per recommendations between the groups, and I would like to highlight one important one, that is application of appropriate antithrombotic treatment that was significantly better in patients undergoing integrated care. So to conclude, ladies and gentlemen, I think integrated AF management is a challenge, but I would rather see it as an opportunity. And I think that integrated care requires a comprehensive patient-centered approach with structured organization of care. And it has the ability to improve clinical outcomes, to improve guideline adherence, and to engage with patients and empower them. And very important is a multidisciplinary collaboration. I think that's crucial. And as you see here in the figure, a patient-centered approach with the patient in the middle, with all the specialties that are involved in AF management around the patient, but a core team of AF nurse and cardiologists/electrophysiologists steered by decision support technology around the patient to really make integrated care work. Thank you.